Hello everyone, welcome to my channel Ravi Static Physio. So in the series of pharmacology, the fifth module we have to be taken into the physiotherapy, which is geriatrics pharmacology. Why geriatrics patients are more prompt to take in the drugs and why we are studying the geriatrics pharmacology we are discussing in this video. So let's discuss about it. It deals with the effect of drug in the older adult as usually individual age 65 and above. Aging causes major physiological changes that alters the way drugs are absorbed, distribution, metabolism, and excretion. So in older adult people, their metabolism is to be slow, their excretion is to be slow, their digestive system is to be slow. So all of the things are slowed down because they're of the aging, which is most common factor. Next one is a hormonal factor. Third one is a genetic factor. The first one is a aging factor. Elderly patients are especially vulnerable to adverse drug reaction because of multiple chronic disease, polypharmacy, reduced organ function, increased sensitivity to medications, cognitive impairment, and poor adherence. So that kind of situation, the patient have to be taken more than one drug in a single time. Basically, it is more prone to older adult, more than 65 year of age. So next is to be what is the goal of geriatric pharmacology. So in adults, improve quality of life, reduce symptoms and disability, avoid adverse effect, and maintain independence towards the patient. So that are the condition we will develop on the patient by the pharmacological drug. Next is to be age-related change affecting the pharmacology. First is pharmacokinetics. The changes is to be first is to be absorption, and changes occurring to be reduced gastric acid secretion. So in the older patient, there have to be gastric secretion of the gastric juices is to be reduced and slow down. The delayed gastric emptying because of the like slow down of the releasing of the gastric juices and delaying the food digestion and emptying of the gas in the tract of intestine or like abdomen and stomach is to be slow down. So reduce intestinal blood flow, that condition, and effect is to be shown then as usually minimal effect on a drug absorption. So if you are taking the drug before the meal, so there is a reduce and absorption and metabolism is to be slow down. Example, the delayed absorption of the analgesics and antibiotics. These are the medication will be taken the patient after the long emptying of the empty of the like their intestinal wall, intestine, and which is GIT tract. So after that, you have to be taking this medication. Next is to be distribution. So what kind of changes is to be shown? To decrease total body water and decrease lean body mass. So these are increase body fat and decrease serum albumin. So that of the condition which is slow down the distribution of the medication into the body or the systemic circulation while reach out that affected organ or particular targeted area. The effect you have to shown into the distribution is to be water soluble drugs of the higher plasma concentration, which is fat soluble drug, prolonged action, increased free drug due to the low albumin. One drug is example is to be diazepam. It accumulates due to the increased fat storage, and warfarin toxicity increase with low albumin. Albumin is present in our blood cell, which is like serum, which is control our like fat absorption or the very like absorption of the nutrients and like send into the different part of the body. So these are two drugs. Their action is to be slow down. Next is to be metabolism. What kind of changes occur in metabolism? Reduce liver mass, reduce hepatic blood flow, reduce enzyme activity. The older patient have to be these symptoms arise and changes due to the aging, and the effect they have to be shown into the bodies to be slower drug metabolism. Also, their half-life is to be increased, drug accumulation, and example is to be sedative drugs. There is opioid remains longer in the body. So if patient have to be complaints, there is no insomnia, and they will take in the sedative drugs, and they will take a drug into the like pills, which is sleeping pills. They will be which is opioid receptors, which is present in our brain. They will longer present in our body, and the effect is to be shown. Last topic is to be excretion in pharmacokinetics. The changes will occur in older patients is to be decline in renal function, reduce glenorenal filtration rate. So that are the condition where patient have to be shown in the older aged patient. And in fact, it will be shown the delayed elimination of the drug and increase toxicity risk. If drug is not excrete out in our kidney, so there will be chance to cause renal kidney or infection into our kidneys. So digoxin toxicity will be occur because that if patient have to be like taken diuretic pills, so it will be accumulate and adhere into their kidneys and like say excrete out the excess sodium and water into the kidneys via kidney, and it will be present over there, and if not excrete out due to the aging, so it will be cause toxicity into our kidney. And gentamicin neuropathy toxicity. These drugs cause nephrotoxicity in nephron. What is the pharmacodynamic changes in adult patient? The older patients show altered sensitivity, so it will be increased sensitivity. Elderly patients are more sensitivity to sedatives, anticoagulants, antihypertensive, anticholinergics. So these are drugs if taken the patient who have to be older patients, so if to be increased sensitivity have to be shown into the pharmacodynamic changes in adult patient. Reduce responsiveness, there due to the aging effect their responsiveness is to be slowed down, and that kind of symptoms arise in the patient which is older. Their symptoms arises to be beta adrenergic agonist drug and sub cardiovascular drug they have to be taken, which come under the polypharmacy. And the polypharmacy in elderly patient, the regular use of more than 5 drugs in a single day, roughly 5% of the adult over the 65 years of age, and it includes the multiple disease, multiple doctor, and self medication, and also the herbal medicine there have to be taken, prescription medicine have to be taken, over the counter drug they have to be taken. So these are the some medication of comes under the polypharmacy. Risk occur in polypharmacies to be drug interaction, medication error, false, confusion, hospitalization will be occur if you are taking 6 to 7 months continuously polypharmacy drug on their health of the older aged patient. Next is to be prevention of the polypharmacy drugs. Regular medication review. You have to review the medical checkup. If there is any kind of side effects, you have to be immediate. Avoid this medication such. Avoid unnecessary drug. You have to be non-need of the like complex drug. You have to be taken without any over-the-counter drug. Simplify dosing schedule. You have to be taking this medication if you have a multiple disease. So you have to be take this medication like a 2 to 5 hour break. Start with low and go slow. You have to be start with a low doses of the drug, and after that you have to be taking the medication into be large amount, but into the slow down. Next is to be adverse effect of a special concern in elderly patient. The older adult are particularly susceptible to certain ADRs due to the physiological decline of their fertility. There have to be fertility have to be reduced, and their hormonal changes have to be occur, and their aging process should be there. So that is the condition. First is to fall and fracture. If patient have to be fall down, their fractures to be occur and cause drug causing sedation, dizziness, impaired balance, and hypotension if they are taking the drug. High risk drugs is to be diazepams, lorazepams, antidepressant, antipsychotic, opioid, antihypertensive drug. And consequences to be hip fracture, disability, increased morbidity, mortality. So these are the consequences, and the drugs you have to be high risk is to be these. And prevention is to be minimize sedatives drugs, fall risk assessment, physical therapy, home safety measure, and regular exercise and yoga you have to be taken as per your therapist and doctor prescription. Next is to be cognitive impairment and delirium. So manifestation is to be occur in the patient of who have to be older adult is to be confusion, agitation, memory problems, and hallucination. So common of the offending drugs are anticholinergic, benzodiazepines, opioid, sedative, or antihistamines drugs. The prevention of these drugs cause harmful impact and side effect. Avoid unnecessary sedative, maintain hydration, review medication regularly. So these are the cognitive impairment dilemmas. Third one is bleeding risk. If the patient have to be taking drugs continuously, the adult patient typically defined as the 65 highly susceptible to the bleeding complication due to the complex interplay or age-related physiological changes. Multiple comorbidities occur in the patient. The cause is to be increased sensitivity to the anticoagulants, reduce liver metabolism, drug interaction, and high risk to drugs what warfarin and aspirin and NSAIDs. These are medication is to be most adverse effect in the older adults, and make sure you have to be taking these drugs in the older age of the prescription of the patient consult of the doctor. The complication is to be occur the gastrointestinal bleeding, intracranial hemorrhage, and monitor in INR. Prevention is to be monitor INR avoid unnecessary NSAIDs, which is non-steroidal anti-inflammatory drug, and dose adjustment. Next is to be renal toxicity. A geriatric patient are highly prevalent due to the age-related declines, and glomerular filtration rate is to be reduced renal blood flow and increase susceptibility to the drug accumulation. So deoxygenol drug is to be accumulate over the kidney, and there is a chance to cause toxicity over the kidney. So high risk drugs is to be NSAIDs and amyloglycosides, contrast agent, ibuprofen, and gentamicin. These are the drugs. Precaution is to be monitor kidney function, ensure hydration, avoid like nephropathic toxicity and combination. Next is to be constipation and urinary retention. These are also occur in the older adult. It is the often linked and frequently accepted by pharmacology. These two conditions are linked because fecal impaction and the rectum can also mechanical pressure on the bladder outlet, resulting the obstruction. There is a hardy stool will be occur into the constipation, and there is a chance to urine retention in the older adult. The long-term exposure of the morphine, amitriptyline drug, and the complication is to be occur in the older adults to be like a fecal infection, urinary infection, and thalassemia. Next is to be postural orthostic hypertension. A fall in a blood pressure when sedative less to be more than high is to be 20 mmHg systolic and 10 mmHg diastolic within a 3 minutes of standing. This is a major risk of occurring to the older adult patient. Mechanism is to be normal standing cause vasoconstriction and increase heart rate in an early individual. The heart rate is to be continuously increased. There is a few minutes of the standing. There has to be not like suffocate and suffer this kind of pain. Autonomic reflexes and impaired baroreceptor sensitivity decrease, drug effect worsen the problem. So that symptoms arise in the postural orthostatic hypotension. Cause is to be age-related cause, reduce autonomic function, dehydration, and reduce vascular elasticity. Drug includes common offering drugs is to be antihypertensive drug, diuretics drug, nitrates, antidepressant, antipsychotic, Parkinson drug. An example of the drugs are furosemide, nitroglycerin, and levodopa. Clinical feature is to be occurring to the patient who has to be Geriatrics, and if they've taken the postural hypotension drug is to be clinical features to be dizziness, fainting, weakness, blurred vision, and falls. How you can diagnose with this condition? The measure blood pressure in supine position and standing after 1 to 3 minutes. You also understand about that the blood patient systolic and diastolic blood pressure. Management is to be non-drug measures: rise slowly, adequate hydration, compress stocking, increase salt intake or decrease salt intake according to the patient, and avoid prolonged standing of such patient. Drug management is to be review medication of the patient of order to reduce dose if possible, avoid multiple hypotension drug and pharmacological treatment. Severe cases may require fluorocortisone and midodorine. These two drugs are taken by the patient who have to be older. This is a geriatric pharmacology. You have to write university examination for the good marks. Thank you.